So let's say there's no cochlea, or let's say that there's not an intact nerve, then a CI is not going to help this person. Because what a CI does is it is inserted into the cochlea and then it stimulates the auditory nerve. Heads up, interpreter, that nerve is called the vestibulocochlear nerve. The layman's term for that is the auditory nerve. That nerve is responsible for hearing and balance. So that imaging, again, is very important because, like I said, if they don't have a nerve, a cochlear implant is not going to help them. Another thing, too, that I think is necessary is to get a psych eval. You want to make sure that this individual has a village. I think we all need a village, to be honest with you, whether you're getting a cochlear implant or not. But especially if you're going through something like this, you want to make sure that you have a support system around you. And you also want to make sure that you can be dependable enough to be motivated to get a CI. So if you say, oh yeah, I mean, I kind of want a CI, that could be cool, I might wear it. If you don't have plans to really use it and make a commitment to it, it's not worth getting surgery for something that you're not going to wear. So that's something that's important too. Okay, so I'm going to tell you guys we're going to focus on one kind of hearing loss. Okay, no, I lied. I'm going to tell you about both of them, and it's not on the slide, and I'm kind of sorry about it. Okay, so there's two different kinds of hearing loss, for the most part. There's conductive, which means that there is something medically going on in this person's outer or middle ear. So let me back up a little bit. What's the outer ear? What's the middle ear? Okay. The outer ear is your pinna, your external ear, and your ear canal. This part is your outer ear. The middle ear starts with your eardrum. The medical term for that is the tympanic membrane. Then it includes 3 middle ear bones, which collectively are known as the ossicles. It also has your eustachian tube in it. So this whole part is the middle ear.
Do you mind saying that station?
Yeah, eustachian tube. Eustachian tube. It's EUSTACHIAN. Good clarification. Thank you for asking. So, what you guys are probably most familiar with, who here has been on an airplane? Great. Okay. When the plane has taken off, have you ever felt your ears pop or felt a pressure? Okay, well, what's happening is your eustachian tube has just opened and closed. The purpose of this tube is to equalize the pressure between your middle ear space and the external environment. So if you're sick or if you have a cold and you feel a sense of fullness, probably because your eustachian tube is getting overworked, and where typically fluid would drain through this tube, you'll kind of feel it go through the back of your throat. If you're sick, you're gonna have a hard time doing that. You're not gonna feel that good, and it's gonna be even more uncomfortable when you get on a plane when you are sick because of this reason, that eustachian tube is getting overworked. There's something going on in your middle ear. And it could potentially cause a temporary conductive hearing loss, potentially. Not always, but another thing you could see, this often happens more so with kiddos. If a kiddo has an ear infection, that is also going to happen in this middle ear space. And that would also cause a conductive hearing loss. So you might hear about a kiddo getting what's called PE tubes. And that stands for pressure equalization tubes. So what a surgeon will do is essentially they'll get a plastic tube, very small plastic tube. So again, you can picture it. There's fluid in this space, Kiddo has chronic ear infections. If an infection stays long enough, it can cause problems in the middle ear space. So in order to get that fluid out, the surgeon will insert a tube into the eardrum, and then that lets the fluid flow out of the outer ear because it's not going down the natural path of the eustachian tube. Okay, so we talked about the outer ear and the middle ear. Let's talk about the inner ear. So the inner ear, you can see this bony structure. This is your cochlea. And then you also see these 3 little circles here. Those are the semicircular canals. This is your inner ear. So if somebody has what's called sensory neural, which is SENSORINEURAL, sensory neural hearing loss, then that means that something's going on in the inner ear. So there's a bunch of tiny little hair cells in the inner ear, and with sensory neural hearing loss, those hair cells are damaged for some reason or another. So we talked about the 2 different kinds. Okay, great. With sensory neural, this also means that because of those damaged hair cells, you're not getting the normal electrical impulses that you would to the vestibulocochlear nerve or the auditory nerve. And therefore...
Can you say that one more time? I'm sorry.
Yeah, no problem. So the cochlea, or the inner ear, cannot transmit those electrical impulses to the brain. And then the brain just isn't getting that information. Where I said conductive hearing loss is usually temporary, there's a medical reason for that hearing loss. Sensory neural hearing loss is usually permanent. So, I know we went over the case history at first. Some of the reasons that I asked, is there any fullness? Is there pressure? Is there any discomfort? If I hear a yes answer to specific questions, then what I will do first, before even considering hearing aids, is I'll send someone off to a physician to be medically evaluated, because it's possible that it's a temporary hearing loss that can be resolved without hearing aids. So they might not need me, and that's okay. Okay, so what exactly does a cochlear implant look like? There's 2 parts. There is an implanted section, which is the internal device, goes right here. And then there's also the external part. Now this dummy is really old. It's typically, they're not this big anymore, for the most part. Just to go over what you're looking at here, again, there's the external processor that's going to be picking up all of the signals. There's also microphones sitting on this part. So this is where the sound is being picked up. That is transmitted to the internal implant, which looks like this. And then the signal is converted into electrical energy. And then that in turn is going to stimulate your auditory nerve, and then the brain is able to receive the signal. So if you picture where that implant is, it's implanted directly into the cochlea to bypass those damaged nerves. And again, not bypass the damaged nerves, bypass the damaged hair cells, and then stimulate the nerve directly. This is an actual cochlea and an actual implanted device on the right here. Okay, so this is another audiogram over here. And there are aided responses from both a CI and also a hearing aid. From the CI, you can see the CI in green. You can tell that the responses with the CI are lower than the responses with the hearing aid. And the reason for this is that a cochlear implant is directly stimulating the auditory nerve, Versus if you're wearing a hearing aid, it has to go through all of those parts of the ear first. It has to go through the outer ear, it has to go through the middle ear before getting to the inner ear and then going up to the brain. Versus a cochlear implant is directly implanted into the inner ear. So it's going to be a better signal. Somebody with a cochlear implant is going to have more access to sound than somebody with a hearing aid in general. Okay, perfect. So there is also the Advanced Bionics remote app. Oh, something that I forgot to mention too is that these apps can also control the cochlear implant. So just some basic knowledge for you. Each of these devices have a very, very smart computer chip in them. So what will happen, let's say I was wearing a cochlear implant in this environment. There's one person talking, but overall it's pretty quiet. That cochlear implant is going to pick an automatic program for quiet situations specifically. And I didn't have to do anything. The cochlear implant is listening to the environment, and that computer chip, that very smart computer chip, is making a decision depending on the environment we're in. Now, if I walk out into the hallway and go outside, well, now there's wind noise, there may be, trees rustling, that kind of thing. It's going to change into an outdoor program to try to limit some of that wind noise. Again, I didn't have to do anything. But let's say that you have someone who really struggles in noise. It's a common difficulty with hearing aids and cochlear implants. Hearing in noises, it's just a hard situation. Even for normal hearing listeners, if you can consider anything normal, don't know that you can, but even for normal hearing listeners, listening in noise is a difficult thing to do. There's a lot of processing involved. Barriers to communication include distance, background noise, not looking at your communication partner, not getting their attention first. So sometimes I'll have people come in and they'll say, my partner doesn't hear me from the other room. And I'll say, okay, all right, and I'll keep that in mind. And then I'll test their hearing, I'll see what things look like, and then I'll talk about some of the barriers to communication. So I'll recommend getting their partner's attention first. You can say their name, and then walking into the same room, looking at them, maybe pausing the TV, those kinds of things. So if you don't hear somebody in that kind of situation, it's probably a communication barrier and not necessarily related to hearing levels. And that can be for anyone. But my original point, so the computer chips are very, very smart. They pick the environments for you. But if there's a specific situation, so let's say listening in noise, that person really struggles in, I can give them a custom program specifically for that situation and adjust it for them. So let's say I have maybe a mom with a kiddo, and mom says, I have a really hard time hearing my daughter's high-pitched voice in noise. Well, I can go in, create a custom noise program, adjust the higher pitches specifically for her daughter's voice, and try to make that better. It's not going to be perfect, but it could help, and that would be a situation I would make a custom program. And that's a long way to say that they can use the app to change programs. Okay. All right. So we made it through all three cochlear implant companies. I'm so proud of us. Okay. So the third and last cochlear implant company is called Med-El. They have an on-the-ear processor called the Sonnet 2, and then an off-the-ear processor called the Rondo. So this is similar to Cochlear's Tanzo, just in concept, just in general. Again, these things, they all look a little bit different, but essentially they're doing the same thing without getting too technical. They're all just different cochlear implants. And a lot of the reason why someone might get a different cochlear implant can be dependent on the surgeon and what internal implant the surgeon's comfortable working with. Another reason could be, if somebody, I recently went to an audiology conference, which was fantastic. It was in New Orleans. I won't talk about it for forever. I could, but I won't. If you have a healthcare provider who has a hearing loss, and let's say they're going to need to be able to listen to sounds of the body. Sounds of the body tend to be in very low frequencies, low pitches. And right now, we actually don't even test out that low for some body sounds. Now, something that would be important to consider if you have a physician or a deaf healthcare professional who's interested in getting a cochlear implant, you would want to check the frequency range of that implant first, because you want to make sure you pick the one that has the lowest possible starting point for the frequency range, so they have the best chance of having access to those body sounds. So that would be a specific reason for picking a different implant.